So importantly, what can you do? Number one, ask and advocate for next generation sequencing. You won't be able to have these discussions and get the most directed therapy without knowing the molecular status of the cancer. Number two, talk to your medical oncologist about the relative pros and cons of targeted therapy, because most of the settings that I've talked about are not FDA approved indications, and it's important to have these discussions. Engage patient advocacy groups to learn more about these therapies and connect with patients who are taking them perhaps in the same setting that you're considering. And plan redundancy, please ask and advocate for next generation sequencing. If you have a localized cancer, you might see a lung doctor and then a surgeon, but never be referred to a medical oncologist. And so it's important to ask to see a medical oncologist, ask for next generation sequencing so that you can really determine the biologic nature of the cancer. So, in conclusion, osimertinib improves disease-free and overall survival in resected stage 1B to 3A EGFR mutated lung cancer and is approved for all patients with resected lung cancer with an EGFR exon 19 deletion or 21L858R mutation. Trials of targeted therapy are ongoing for patients with surgery or patients after surgery, before surgery, and after curative intent chemoradiotherapy. However, can we already now extrapolate our approach of giving osimertinib after surgery to those with other types of driver mutations and to those after curative intent with chemoradiotherapy? I think the answer to this is yes, and we're already starting to do this for some types of subgroups of driver mutations. There are many important questions that remain, however, including what is the appropriate duration of treatment, who truly needs targeted therapy, who is cured by surgery with or without chemo. As I alluded to earlier, immunotherapy is not likely to be beneficial for most patients in this setting. And then I cannot stress the importance enough. Next generation sequencing to assess for driver mutations is critically important to determine the most appropriate treatment approach.